continuing our coverage of the coronavirus pandemic. 7 News, we are receiving a lot of your questions through emails, Facebook, all about COVID-19.
All right, so we have Dr. Matthew Delfino here to help answer some of those questions. So first off, thank you so much for joining us this morning. It really means a lot. You know, there's just so much going on right now, social media-wise, so we wanted to get some answers. So I guess the first question that Christine and I will start off with, where did this virus come from? That's the #1 question I've been seeing a lot of.
Yes, so as we have seen on the news, it started in China.
Right.
And we believe that it came from animal contact.
Okay.
Coronaviruses all have an animal host, including cats, cattle, bats.
Wow.
And so it's possible that while people were at a market buying products, they came in contact with the virus.
I saw that. It's actually called a wet market in China, and they sell all of those products. So how would the virus jump from that animal to a human?
Love it.
So the virus itself can be in both humans and animals, and so once it makes a transformation that allows it to get into humans, all it takes is contact, just like we're spreading it now among ourselves. Hand to mouth.
Wow, okay.
Or other types of particles that get in your respiratory tract.
One thing I thought was interesting, you mentioned a coronavirus. It sounds like there's more than one. Corona, what even does that mean?
So the virus is actually called SARS coronavirus #2.
Well, that's familiar.
And it causes a disease called coronavirus disease 2019, which is why we see COVID-19 as an abbreviation. And these are viruses that typically cause colds, but there are 3, and this is one of them, that cause more severe illness.
Wow, especially in, I know, those with compromised immune systems, older adults, when you start to see those symptoms, when you start to maybe not feel well, maybe how soon before you contract it do you show those symptoms?
So usually it's about 2 to 5 days, but it can happen up to 14 days, which is why people need to protect themselves and stay away from others if they think they may have it for up to 2 weeks.
And how would I know to get checked out? What are the symptoms?
Yeah, good.
So usually it starts with a sore throat, cough, and fever.
Okay.
And if you have those symptoms, it's a good idea to be thinking about seeking advice.
So we're healthy. Christine and I are healthy people. We exercise. We try to eat pretty good. I think a big concern and maybe a myth, I know I've heard multiple people say, hey, if you get it, you'll end up in the hospital.
Right.
What are the chances that someone like Christine and I would end up in the hospital?
So obviously it's hard to say depending on your certain health circumstances, but most people that are healthy are going to experience cold and flu-like symptoms.
Okay.
And the chances that you end up in the hospital are low, probably 5 or 6%. But again, people who have more severe health problems are more likely to get severe symptoms, even more sick than like the common flu.
Wow.
Very good. Hey, also thank you to everybody who's kind of asked those questions. It's not always the most comfortable thing to do.
Absolutely.
I know I asked on Facebook, social media, which we know can be a little dangerous sometimes. There's a lot of information that you just don't know.
And I got props to you for being a doctor during this time. Man, it's a tough time right now.
Yeah, it's been busy.
Yeah.
I've got Russ Sanders here asking, would you explain maybe the difference between confirmed cases and suspected number of undiagnosed cases?
Sure. So if you do present to a healthcare facility and get tested, you can be found to be positive. However, that test needs to be confirmed either by the public health lab or the CDC.
Somebody else.
And so it may take an extra day or 2 for that to occur.
But it does sound like they're being sent off pretty quickly. It is being addressed very fast.
Right. If you're swabbed, that test will usually arrive at the lab the next day or even that day if it goes to our lab here in Columbia.
So that leads me to say, when did we actually start testing for this? Could someone have already had the coronavirus and not know it in the U.S., do you think?
Unfortunately, yes, that's probably true. Our testing has only really ramped up over the last few days, including this weekend. And so next week, we'll probably see much more testing occurring and probably see the case numbers increase.
Okay.
Oh,
yeah.
wow. And you know, I know had a couple questions, people asking even specifics like race and things like ethnic diversity.
That was one of the things I've been saying. People were saying the Black community cannot get this, you know, and I know there's a lot of myths out there. And this is just being real. I saw this on a lot of people. They're like, the African American community cannot get that. Is that a myth, or is this true?
So unfortunately, it's a myth. It'd be nice if some people were protected from it, but this particular virus affects a part of your lung called ACE2. And everyone has ACE2, and it's deep in your lungs. And so therefore, if the virus does come in contact with your respiratory tract, it has this avenue to get deep inside your lungs and cause disease.
So it's the insides. It has nothing to do with skin tone? Or
That's right.
Okay, absolutely.
Very good.
Well, we do have a couple more questions, so we'll be right back. Thank you so much for joining us. So we'll go ahead and continue this conversation coming up in a couple minutes. Thanks so much for joining us on 7 News Daybreak. We'll be